A patient receiving warfarin is prescribed amoxicillin for sinusitis. The nurse should monitor for A. Increased warfarin effect leading to bleeding. B. Decreased warfarin effect leading to thrombosis. C. No interaction between antibiotics and warfarin. D. Increased blood pressure. Answer: A. Rationale: some antibiotics, including amoxicillin in certain cases, can alter gut flora and warfarin metabolism, increasing INR/bleeding risk. Teaching point: monitor INR and watch for bleeding when starting antibiotics. Which side effect is most important to monitor in a client taking simvastatin? A. Cough and bronchospasm. B. Muscle pain and elevated CK indicating possible rhabdomyolysis. C. Hyperglycemia only. D. Urinary retention. Answer: B. Rationale: statins have a risk of myopathy and rhabdomyolysis, monitor for muscle pain and CK. Teaching point: report unexplained muscle pain or dark urine, avoid grapefruit with some statins. A client with hypertension is prescribed losartan. Which statement shows understanding? A. I should avoid potassium-rich foods while on losartan. B. If pregnant, losartan is safe to continue. C. Losartan may cause hyperkalemia and must be stopped if planning pregnancy. D. Take losartan with a high-salt snack to reduce side effects. Answer: C. Rationale: ARBs like losartan can cause hyperkalemia and are contraindicated in pregnancy due to fetal toxicity. Teaching point: avoid pregnancy on ARBs, monitor potassium and renal function. A postoperative client is receiving morphine and is drowsy with respiratory rate of 8 breaths/min. Which is the priority nursing action? A. Encourage deep breathing and coughing. B. Administer naloxone per protocol. C. Give supplemental oxygen and reassess. D. Document findings and notify family. Answer: B. Rationale: opioid-induced respiratory depression with RR less than 10 requires naloxone per protocol to reverse life-threatening effects. Teaching point: monitor respiration and sedation, have naloxone readily available. A client taking prednisone for asthma reports increased appetite, weight gain, and insomnia. What is the best explanation? A. These are effects of corticosteroid therapy. B. Prednisone causes decreased appetite and weight loss. C. The client should stop prednisone immediately. D. These symptoms indicate infection. Answer: A. Rationale: systemic corticosteroids cause appetite increase, weight gain, insomnia, and mood changes. Teaching point: taper steroids as prescribed, monitor for long-term effects, osteoporosis, hyperglycemia. When teaching about ibuprofen use, which instruction is correct? A. Take ibuprofen daily on an empty stomach to maximize absorption. B. Use ibuprofen cautiously with a history of peptic ulcer disease. C. Ibuprofen does not affect platelet function. D. Take with warfarin to reduce clotting risk. Answer: B. Rationale: NSAIDs like ibuprofen increase risk of GI bleeding and should be used cautiously in peptic ulcer disease. A client on hydrochlorothiazide complains of muscle cramps and weakness. Which lab should the nurse anticipate to be abnormal? A. Hypernatremia. B. Hypokalemia. C. Hyperkalemia. D. Elevated glucose only. Answer: B. Rationale: thiazide diuretics cause increased urinary potassium loss leading to hypokalemia, which can cause cramps and weakness. Teaching point: monitor electrolytes, encourage potassium-rich foods if appropriate. A nurse is preparing to administer diazepam 4 for status epilepticus. What is the major nursing concern during administration? A. Hypertension. B. Respiratory depression and airway protection. C. Hyperactivity. D. Hypoglycemia. Answer: B. Rationale: benzodiazepines can depress respiratory drive, airway management is essential during administration. Teaching point: have resuscitation equipment available and monitor respiratory status continuously. A client on levothyroxine reports palpitations, heat intolerance, and weight loss. The nurse suspects: A. Under replacement of thyroid hormone. B. Overreplacement of thyroid hormone, excess dose. C. Side effects of beta-blocker therapy. D. Adrenal insufficiency. Answer, B. Rationale: symptoms of palpitations, heat intolerance, and weight loss suggest thyrotoxicosis from excessive levothyroxine. Teaching point: report signs of hyperthyroidism, dose adjustments may be necessary. A client is started on amlodipine for hypertension. Which adverse effect should the nurse teach the client to expect? A. Bradycardia. B. Peripheral edema and flushing. C. Diarrhea only. D. Hypokalemia. Answer, B. Rationale: dihydropyridine calcium channel blockers like amlodipine commonly cause peripheral edema and flushing. Teaching point: elevate legs and report severe swelling, continue medication unless instructed otherwise. A nurse is teaching a client about acetaminophen use. Which statement is correct? A. Maximum daily dose for healthy adults is 4,000 mg per day. B. It is unsafe for clients with liver disease. C. It is an NSAID and causes GI bleeding. D. It should be taken with aspirin for better pain control. Answer: A and B are both true, but best single choice, B, for Nclex style pick. Rationale: acetaminophen max for many guidelines is 3,000 to 4,000 mg/day. It is hepatotoxic and contraindicated or used cautiously in liver disease. Teaching point: do not exceed recommended dose, avoid alcohol and check combination products for acetaminophen. Note: if forced choice, select B to emphasize liver risk. A client receiving gabapentin for neuropathic pain complains of dizziness and drowsiness. The nurse should: A. advise the client that these are common and to avoid driving until effects subside. B. stop gabapentin immediately. C. increase the dose to overcome side effects. D. encourage alcohol use to help sleep. Answer, A. Rationale: gabapentin commonly causes sedation and dizziness. Patients should avoid activities requiring alertness until stable. A patient taking simvastatin asks why their liver enzymes are being monitored. The nurse explains. A. statins can cause hepatotoxicity, so LFT monitoring is recommended. B. liver enzymes monitor muscle injury only. C. there is no need to monitor liver function with statins. D. statins protect the liver, so monitoring is unnecessary. Answer, A. Rationale: statins can rarely cause hepatocellular injury, baseline and periodic LFTs are often obtained. Teaching point: report jaundice or persistent GI symptoms. A client with bacterial pneumonia is prescribed ciprofloxacin. Which teaching point is most important? A. take with dairy products to improve absorption. B. avoid strenuous exercise due to risk of tendon rupture. C. it is safe to use in pregnancy. D. no interactions with antacids. Answer, B. Rationale: fluoroquinolones carry a risk of tendinitis and tendon rupture. Caution older adults and those on steroids. Teaching point: avoid high-impact exercise while taking. Separate antacid/calcium from dose to avoid reduced absorption. A nurse is calculating a medication dose. The order is digoxin 0.125 mg daily. The available tablet is 0.25 mg. The nurse should: A. give half a tablet, 0.125 mg, daily. B. crush and give entire tablet. C. give 0.25 mg and monitor closely. D. refuse to give and ask for a different med. Answer, A. Rationale: splitting a scored tablet to achieve the prescribed dose is appropriate. Digoxin requires precise dosing. Teaching point: verify tablet is scored, document dose and monitor for digoxin toxicity. A client on long-term prednisone is scheduled for a vaccine. Which vaccine requires caution or avoidance? A. inactivated influenza vaccine. B. live attenuated vaccines, e.g., MMR, varicella. C. tetanus toxoid. D. hepatitis B recombinant vaccine. Answer, B. Rationale: high-dose systemic steroids cause immunosuppression. Live vaccines are contraindicated. Teaching point: Coordinate immunizations before starting immunosuppressants when possible. A nurse administers 4 potassium chloride to a hypokalemic client. Which action is essential during infusion? A. Infuse rapidly to correct potassium fast. B. Monitor cardiac rhythm and infuse via infusion pump. C. Give as in 4 push for immediate effect. D. Mix with dextrose to increase uptake. Answer, B. Rationale. For KCl must be infused slowly via pump with cardiac monitoring to avoid arrhythmias. Teaching point. Never give KCl 4 push, dilute properly and check urine output. A diabetic client taking insulin reports sweating, trembling, and confusion. The nurse suspects hypoglycemia and should first A. Give 15 to 20 g of fast-acting carbohydrate, juice or glucose gel. B. Give insulin to balance blood sugar. C. Call for a PRN beta blocker. D. Check urine ketones. Answer, A. Rationale. Treat hypoglycemia promptly with fast-acting carbohydrate, then recheck blood glucose. Teaching point. Follow the 15-15 rule, 15 g carbs, wait 15 minutes, recheck. A client receiving low molecular weight heparin, enoxaparin, asks about bruising. Which is correct teaching? A. Bruising is common, avoid NSAIDs and use soft toothbrush. B. Bruising indicates immediate need to stop medication. C. Heparin causes hypertension. D. There are no bleeding precautions needed. Answer, A. Rationale. Anticoagulants increase bleeding/bruising risk, take precautions to reduce bleeding. Teaching point. Use electric razor, soft toothbrush, avoid NSAIDs, and report significant bleeding. A client on long-term proton pump inhibitor therapy asks about magnesium testing. The nurse explains. A. PPIs can cause hypomagnesemia with prolonged use, monitor magnesium if symptomatic. B. PPIs always increase magnesium levels. C. There is no electrolyte effect from PPIs. D. Only potassium needs monitoring. Answer, A. Rationale. Long-term PPI use has been associated with hypomagnesemia, check electrolytes if symptoms. Teaching point. Report muscle cramps, tetany, or seizures. A client is prescribed atenolol for hypertension. Which condition would require caution or an alternative medication? A. Asthma or reactive airway disease. B. Hyperthyroidism. C. History of peptic ulcer disease. D. Allergy to sulfa drugs. Answer, A. Rationale. Beta-1 selective blockers like atenolol are safer in asthma than non-selective, but caution is still needed, alternatives may be preferred. Teaching point. Monitor for bronchospasm, hold if wheezing occurs. A nursing student asks why aspirin is held for a client receiving thrombolytic therapy. The nurse replies. A. Aspirin increases bleeding risk when combined with thrombolytics. B. Aspirin prevents thrombolytics from working. C. Aspirin causes thrombosis with thrombolytics. D. No interaction exists. Answer, A. Rationale. Antiplatelet agents increase bleeding risk when combined with thrombolytics, management depends on protocol. Teaching point. Always check medication history before thrombolytic therapy. A client with kidney impairment is prescribed gabapentin. The nurse should A. Anticipate dose reduction because gabapentin is renally excreted. B. Give the usual dose regardless of kidney function. C. Stop gabapentin and give morphine instead. D. Increase dose to achieve effect. Answer, A. Rationale. Gabapentin is renally eliminated, dosing must be adjusted in renal impairment. Teaching point. Monitor renal function and watch for increased sedation. A client is taking clopidogrel after stent placement. The nurse teaches that stopping clopidogrel early can result in A. Increased bleeding risk only. B. Stent thrombosis and myocardial infarction. C. Hypertension. D. No significant consequence. Answer, B. Rationale. Premature discontinuation of antiplatelet therapy increases risk of stent thrombosis. Teaching point. Adhere to antiplatelet regimen, inform prescribers before stopping. A client on chronic opioid therapy is beginning buprenorphine for opioid use disorder. The nurse explains that buprenorphine A is a full opioid agonist with no ceiling effect. B is a partial agonist that can precipitate withdrawal if full agonist is present. C causes no withdrawal symptoms. D is ineffective for opioid dependence. Answer, B. Rationale: buprenorphine is a partial agonist. It can precipitate withdrawal if administered while full agonist effects are present. Teaching point: ensure client is in mild-moderate withdrawal before initiating buprenorphine. A client experiencing an acute asthma attack is given albuterol via nebulizer. The nurse expects which immediate effect? A. Bronchodilation and decreased wheezing. B. Increased mucus production. C. Systemic immunosuppression. D. Long-term airway remodeling. Answer, A. Rationale: short-acting beta-2 agonists cause bronchodilation and rapid symptom relief. Teaching point: monitor HR and tremor, teach proper inhaler/nebulizer technique. A nurse prepares to give a cephalosporin antibiotic to a client with a documented severe penicillin anaphylaxis. The nurse should A. Administer with caution, cross-reactivity risk exists. B. Proceed, cephalosporins are always safe. C. Double the dose to ensure efficacy. D. Use concurrently with penicillin for synergy. Answer, A. Rationale: there is some cross-reactivity between penicillins and cephalosporins. Severe penicillin allergy warrants caution and possibly alternative class. Teaching point: clarify allergy history, consult prescriber for alternatives. A client on isoniazid for latent TB should be taught to take pyridoxine, vitamin B6, to prevent A. Hepatotoxicity only. B. Peripheral neuropathy. C. Visual changes. D. Hyperkalemia. Answer, B. Rationale: INH can cause pyridoxine deficiency leading to peripheral neuropathy. B6 prevents this. Teaching point: take vitamin B6 as prescribed and report numbness or tingling. A patient is receiving an aminoglycoside antibiotic. Which adverse effects should the nurse monitor for? A. Ototoxicity and nephrotoxicity. B. Cardiotoxicity only. C. Hepatotoxicity only. D. Hyperglycemia. Answer, A. Rationale: aminoglycosides can damage kidneys and inner ear, monitor renal function and hearing. Teaching point: check trough levels, report hearing loss or balance issues. A postoperative client is prescribed heparin subcutaneously for DVT prophylaxis. Which nursing practice is correct? A. Administer IM to increase absorption. B. Inject into the abdomen and do not aspirate. C. Massage the site after injection. D. Use the same site repeatedly without rotation. Answer, B. Rationale: subcutaneous heparin is given into the abdomen, do not aspirate or massage, and rotate sites. Teaching point: monitor for bleeding and heparin-induced thrombocytopenia. A client taking oral corticosteroids reports black, tarry stools. The nurse recognizes this as A. A sign of GI bleeding and requires immediate evaluation. B. Normal with steroid therapy. C. An indication to increase steroid dose. D. A sign of improved GI health. Answer, A. Rationale: GI bleeding is a serious adverse effect. Steroids can mask symptoms and increase risk with NSAID use. Teaching point: report melena immediately. A client started on prednisone for inflammatory disease is also diabetic. The nurse should anticipate A. Decreased glucose levels. B. Elevated blood glucose requiring closer monitoring and possible insulin adjustment. C. No effect on glucose control. D. Hypoglycemia. Answer, B. Rationale: steroids increase gluconeogenesis and insulin resistance, raising blood glucose. Teaching point: monitor blood glucose closely and coordinate with provider for adjustments. A client on chronic NSAID therapy complains of tinnitus. The nurse recognizes tinnitus as a sign of toxicity for which NSAID? A. Ibuprofen at any dose. B. High-dose aspirin, salicylate toxicity. C. Acetaminophen. D. Omeprazole. Answer, B. Rationale: tinnitus is a classic early sign of salicylate, aspirin, toxicity. Teaching point: report ringing in ears and avoid excessive dosing. A client is prescribed nitroglycerin sublingual for chest pain. Which instruction is essential? A. Place tablet on tongue and allow it to dissolve, do not swallow immediately. B. Take a large meal before dosing to increase absorption. C. Store tablets in warm, humid place. D. Take one dose every 5 minutes until pain resolves, with no limit. Answer, A. Rationale: sublingual nitroglycerin should dissolve under the tongue for rapid absorption, storage should be cool/dry. Teaching point: if chest pain persists after 3 doses, 5 minutes apart, seek emergency care, avoid PDE5 inhibitors. A client on lithium therapy for bipolar disorder should be taught to avoid which change that affects lithium levels? A. Maintaining steady salt and fluid intake. B. Decreasing sodium intake drastically or volume depletion increases lithium. C. Drinking adequate fluids daily. D. Reporting tremors only if severe. Answer, B. Rationale: low sodium or dehydration reduces lithium excretion, increasing toxicity risk. Teaching point: maintain consistent salt and fluid intake, monitor levels. A nurse prepares to administer an influenza vaccine to a pregnant client. Which vaccine type is appropriate? A. Inactivated influenza vaccine. B. Live attenuated intranasal vaccine. C. Any live vaccine is acceptable. D. No vaccines are allowed in pregnancy. Answer, A. Rationale: inactivated influenza vaccine is safe in pregnancy, live vaccines are contraindicated. Teaching point: vaccinate pregnant clients with inactivated vaccines per guidelines. A client is taking trimethoprim sulfamethoxazole and reports a rash. The nurse recognizes this may indicate A. A common benign side effect requiring no action. B. A potential hypersensitivity reaction that may progress to Stevens-Johnson syndrome. C. Guaranteed renal failure. D. Improved drug efficacy. Answer, B. Rationale: sulfonamides can cause severe hypersensitivity reactions including SJS, rash warrants evaluation. Teaching point: stop drug and seek medical care for rashes or mucosal lesions. A client on digoxin presents with nausea, visual disturbances, yellow halos, and bradycardia. The nurse suspects A. Hypokalemia only. B. Digoxin toxicity. C. Normal side effects not requiring action. D. Hypercalcemia. Answer, B. Rationale: digoxin toxicity presents with GI, visual, and cardiac symptoms, immediate assessment and drug level testing indicated. Teaching point: monitor potassium and digoxin levels, no signs of toxicity. A patient is ordered to receive an 4 infusion of ampicillin. The nurse notes the 4 site is red and warm with pain. What is the priority action? A. Stop the infusion and restart at a new site. B. Continue and document only. C. Warm the site and leave cannula in place for infusion. D. Slow the infusion rate and observe. Answer, A. Rationale: infiltration/chemical irritation requires stopping infusion and restarting elsewhere to prevent tissue injury. Teaching point: monitor 4 sites frequently for phlebitis and infiltration. A nurse teaching a client about oral contraceptives notes that antibiotics may reduce effectiveness. The correct counseling is A. Use additional contraception while taking certain antibiotics and for 7 days after. B. Antibiotics have no effect on oral contraceptives. C. Stop antibiotics if taking OCPs. D. Double OCP dose while on antibiotics. Answer, A. Rationale: some antibiotics may reduce enterohepatic recirculation of estrogens, use backup contraception per guidance. Teaching point: use condoms or another method while on interacting antibiotics and per prescriber guidance. A client on digoxin and furosemide is at increased risk for digoxin toxicity due to A. Furosemide-induced hypokalemia increasing digoxin sensitivity. B. Furosemide raising potassium levels and protecting from toxicity. C. No interaction between these drugs. D. Furosemide decreasing digoxin levels. Answer: A. Rationale: hypokalemia from loop diuretics increases myocardial sensitivity to digoxin, raising toxicity risk. Teaching point: monitor electrolytes and digoxin levels, especially when using diuretics. A nurse is preparing to give an intramuscular vaccine to an adult. Which site is preferred for most IM adult injections? A. Deltoid muscle. B. Gluteus maximus in all adults. C. Forearm. D. Abdomen. Answer: A. Rationale: the deltoid is commonly used for adult immunizations, gluteal site avoided in some due to sciatic risk. Teaching point: use correct needle length and technique, rotate sites. A client taking isosorbide mononitrate experiences headaches after first doses. The nurse should: A. Explain that headaches are a common side effect and may diminish over time. B. Stop nitrate immediately for any headache. C. Recommend taking sildenafil to relieve headaches. D. Ignore the complaint. Answer: A. Rationale: vasodilatory headaches are common with nitrates and often decrease with continued use. Teaching point: use analgesics for severe headache and avoid PDE5 inhibitors while on nitrates. A nurse is about to administer an antibiotic and notes the client's chart documents a severe anaphylactic reaction to that class previously. What is the correct action? A. Withhold the antibiotic and notify the prescriber for an alternative. B. Give half the dose to test for reaction. C. Pre-medicate with antihistamine and give full dose. D. Proceed because severe allergies are rare. Answer: A. Rationale: administering a drug with documented severe allergy risks life-threatening reactions, withhold and get alternative. Teaching point: always review allergies before medication administration, document reactions and educate the client. Great job making it through all 50 pharmacology questions. Remember, success on the Nclex comes from consistent practice and understanding the why behind each answer, not just memorization. Keep reviewing, stay focused, and trust yourself, you've got this. Don't forget to like, subscribe, and share to help other nursing students on their journey to becoming amazing RNs.